Good afternoon, everyone, and thank you for joining us for today's webinar on the 2022 RUS DLT grant. I'm Kristen DeProspero, the Vice President of Grants and Adoption Services at Solutionz. I'm joined by co-host Kathleen Harrell, partner at Salient Health Solutions, and we're thrilled to have the USDA Grants Management Specialist, Teresa Hunkapiller, lead us in today's discussion. Just a few housekeeping notes to go over before we get started. All attendees' cameras and microphones have been muted. This presentation is being recorded and will be available starting tomorrow on the Solutionz Inc. YouTube channel. We hope that you will share the recording with any colleagues who may not have been able to attend today's sessions. There is a lot of information to go over today, and I'm sure you'll have questions. So please feel free to use the chat box for those questions, and we'll answer them at the end of the presentation. I need to also share a disclaimer provided by the USDA before we get started. Grant applications that are written by vendors who are mentioned in the application as vendors to be used on the project to be funded by the DLT award are ineligible as a violation of the competition rules in 2 CFR 200.319. Such vendors are also prohibited from bidding on the project because of conflict of interest. Also, if the grant writer for the application is paid by a vendor, manufacturer, system integrator, or other business, the vendor, manufacturer, system integrator, or other business becomes an affiliate of the applicant and cannot participate in the project, and that vendor written applications will prevent the vendor from doing work on the project. So, for clarity and disclosure purposes, Solutionz is hosting this session. However, Solutionz is not being recommended by the USDA as they are vendor agnostic and vendors are not applicants of this grant. We are hosting this event and providing the platform for the meeting as a host to attendees. Solutionz does not provide any grant writing services. Thank you all again for joining us, and it is my pleasure to turn this presentation over to Kathleen, a trusted grant consultant and expert on this program. Her firm helps organizations pursue and manage the grant seeking process, and they have decades of experience with this USDA initiative. So Kathleen, over to you.
Thank you so much, Kristen. And I'm going to start to share the presentation, so everybody should be able to see my screen at this time. I'm grateful that Teresa is with us today as well. I'm going to share just a little bit more about her background. Teresa, for 10 years, was a general field representative with the USDA, overseeing projects in multiple states, and then she moved on to becoming the supervisor for all the general field representatives. So she has a lot of experience, not only with the USDA, but with the Distance Learning and Telemedicine grant program. She now serves as the grants manager, for the Distance Learning and Telemedicine grant. So she's going to share a little bit about her experiences. We're both going to talk about some best practices, some challenges that we've seen faced by organizations in applying. And as you're starting to think about your next application, what are those things that you might want to keep in mind? So we're very grateful to have her here today. I'm going to jump right in and start to talk about an overview of what we'll see and talk about today. But one of the first things that I want to say, and I'll say this throughout the presentation, the FY 2023 Distance Learning and Telemedicine grants, or DLT grants as they're commonly known, they are not out yet. So the last cycle is closed and the new cycle will be beginning over the next couple of months. We're not sure when that grant will be released. When it is released, the USDA will do a presentation walking through the actual scoring criteria and a lot of the information that you'll see here today. We are basing our slides and our presentation on last year's grant application. However, it's appropriate to do so to share some of these lessons learned and information, because typically the grants do not change that much over the course of each year. There will be some changes, and we'll note those as we go, such as with special point considerations. But Teresa, on any given year, does the application change very much, or does it pretty much remain similar?
Hello, everyone, and thank you for having me. And yes, it is very consistent from year to year. There is usually a change in the focus of special consideration points, and those kind of follow the flow of the focus of the administration or whatever happens to be the hot topic that year. In the past, we have focused on STEM, we focused on opioid, we focused on substance use disorder. And so those are the type things that change, and you will see that more than likely year to year. But other than that, it's one of the most consistent programs I've worked on.
That's great. That's very helpful information. So to start to just give you an overview of what we're going to focus on today, you'll see that we're going to give you some background information on the Distance Learning and Telemedicine, or DLT grants. We're going to talk about who's eligible, who can actually apply, eligible in terms of both who can apply and then what you can actually apply for. Matching, there is a match component to this grant we want to make you aware of, and thinking through how you might meet that match. And then we'll walk through the scoring criteria. There's both objective and subjective scoring that includes different grant components such as worksheets and other resources that the USDA makes available. So we're going to go through all of that now, but we will definitely leave time for questions at the end, and you absolutely can be asking questions and raising your hand in the chat to ask questions as we're going through the presentation. And Kristen, would you mind just noting if there are questions in the chat, just to see if there's anything that we might need to raise?
Sure, absolutely.
So jumping right in here to looking at how the USDA defines distance learning and telemedicine, especially given the last 2.5 years of COVID. I think we're all familiar now with the concept of distance learning, but when the USDA talks about distance learning, they mean the real-time interactive delivery of curriculum or course material through technology. So it has to be real-time to be considered distance learning for this grant. And there's a couple of different types of projects we see frequently. That is a hub site or a more urban location, such as maybe a university or a community college that's actually providing distance learning course material to more rural areas. We also see very frequently that there are rural areas that are sharing resources. So if there's a STEM program in one rural area, they might be connecting all the way across the country to another rural area or across the state to share that information. In terms of telemedicine, very similar definition, only here it's real-time interactive telecommunication links with an end user, and that person's a medical professional who's providing some form of care or service to you. And so that definitely benefits rural residents for a number of reasons, because they're not traveling. As you know, given the pandemic over the last 2.5 years, even those in urban areas didn't want to be traveling into certain healthcare facilities at certain points, and so they were able to communicate via those telemedicine links. Teresa, anything you want to offer on those definitions?
No, ma'am, I think you did an excellent job stressing that it is real-time interaction between someone on both ends.
Thank you for that. So we're going to move into now who's eligible. So applicant eligibility. So for these grants, basically most organizations are going to be eligible. The two types of entities that are ineligible, individuals can apply and partnerships cannot apply. But incorporated entities, if they're for-profit or not-for-profit, they're eligible. Indian tribes or tribal organizations are eligible. State or local units of government, counties, municipalities, cities, towns are eligible. Consortiums. I'll talk a little bit about consortiums and give you another slide for that piece. So there's two types of consortiums, some that are formal, that are actually incorporated entities that operate legally and have the ability to contract. And in order to be a formal consortium, you do need to be an incorporated entity. If you're an informal consortium, so you are a group that might come together to purchase equipment or to do learning or telemedicine initiatives together, but you have not formally incorporated, you're considered an informal consortium, and there's two ways for you to be eligible. The most common way that I've seen, it might be different for others, is to have a host organization. So one organization who is applying on behalf of the greater number of members in that consortium, or each individual entity within the consortium can choose to contract with the USDA, with RUS. Anything anybody might want to add, Teresa, you specifically, or anything on applicant eligibility?
I just wanted to mention the consortium usually tends to be a long, slow process. We do them and we have successful projects, but you have to be extra careful, and the applicant owns and is responsible for the equipment and the reporting and compliance. So keep that in mind when you're doing a consortium. If you're an informal consortium, that means if you're doing it informally and every single one wants to sign and own their own equipment, you're going to get into a lot of paperwork and a lot of documentation, because every single one has to report and act just like the applicant. So just a word of caution, we don't mind them. People just need to know going into them that they're a little bit more time consuming.
That's great. And I think it's also helpful to be thinking about as you're walking through if you're going to apply and how you're going to apply, thinking about those partners, who's going to be helpful in terms of both operational components, who has the telemedicine pieces that you need, those doctors or those resources, or who has the curriculum components that you need, but also be thinking about, and we'll share this with you, how are you meeting that objective scoring at a high level that's going to make you more competitive. And we'll talk about competitiveness as we're going through the application, or excuse me, the presentation, which goes through the application. So eligible grant purposes.
Kathleen.
Yes.
Sorry to interrupt. I just wanted to add that partnerships, we've seen in the past a few instances where people would believe they had their partnerships completely set up. But I just want to reiterate that it's really critical and important to make sure that there's concrete information and communication between the applicant and fiscal agent and those partners to confirm that they really kind of know what's happening and that they're involved, because between the time the application is submitted and then potential award notifications, there can be quite a long period of time. So communication, I guess, is key, was my point.
That's a great point. And yes, you want to make sure that everybody is committed to the application. And sometimes they're not required of the USDA, but for your own purposes, if you're the lead applicant, it's sometimes helpful to have letters of commitment. Again, you're not going to be submitting those letters of commitment to the USDA if they're not match or other components. But as an applicant, they give you some reassurance that somebody and senior leadership is committing to the grant. So a potential best practice there. Eligible grant purposes. So probably one of the most common questions that's asked, what can this grant pay for? We're going to talk about eligible costs and then ineligible costs. So this grant is about acquiring or leasing eligible equipment, distance learning or telemedicine equipment that fits that definition of real time. So if it's a leased piece of equipment, then the lease during the 3-year life of the grant is eligible to be a cost for the grant. If you're acquiring the actual equipment itself, you need to show what the percentage of time that equipment will be used for distance learning or telemedicine purposes. And quite frequently, that's 100% of the time because you're designating that equipment for distance learning or for telemedicine. But that's, and in the grant, they ask you what is the percentage of time by which you're going to use that equipment. And if it's anything less than 100, then the USDA is paying for the amount, the percentage of time you're going to be using that equipment. For broadband facilities, which are a little bit, at least in my experience, smaller or fewer applicants apply, but broadband facilities must be applicant owned and they are limited to 20% of grant funds. Acquiring instructional program, that's a capital asset, is eligible under the grant criteria. And then providing technical assistance or instruction is also eligible, but it's limited to 10%, so 10% of the grant funds. Teresa, anything else there that we should add?
I did want to mention that we are seeing, just recently I ran up against a problem with a grant that had requested to lease equipment, and we agreed to it. It's, in the regs, they can do that. But they were trying to lease some equipment that was going to be end-of-life equipment prior to the end of the grant. And we fund new and like new undepreciated equipment. So just because you're leasing it, we don't lower the standards. I mean, we still expect, if you're leasing, for it to be new, undepreciated equipment, and it's going to last the life of the grant. The second side of that is, one of the requirements is to show that this grant's going to be sustainable after the 3 years of our funding. And if you have leased equipment for 3 years, you need to let us know what you're doing at the end of that 3 years to make this sustainable. So that's my precautions, I would say, to take when you're looking at leasing versus purchase. You can make the case that that is what you want to do and why, but I would definitely consider the route of purchasing and owning after the 3 years to help assure your sustainability.
That's very helpful. Thank you for that. So moving now into ineligible grant purposes, the question that I get asked probably most frequently is, can we pay for salaries or admin costs with this grant? The answer is no, those costs are ineligible. So medical or educational equipment not having any functionality for distance learning or telemedicine is prohibited. Electronic medical record systems, those salaries, admin, or operating costs that we've talked about. Recurring broadband fees is a common question. They are not allowed. Application preparation costs, so having a grant writer help you write your grant, you cannot write those costs into this grant. The purchase of land, buildings, construction, those types of things, not allowed for this grant. And any purpose not specifically contained in the actual federal regulation that governs the grant program, not allowed. So equipment that is focused on distance learning and telemedicine, those are your eligible pieces. Again, the USDA will look at the percentage of time you're using that equipment for that purpose, and they will base your budget accordingly. So you will have to decide, is it 100% or other? So those are eligible and ineligible purposes. There is a required match for this grant. It is 15%. And that means that if the grant amount is $1 million, then your grant is 15%, then your if your budget is, requesting $1 million, then 15% more is going to be what you are due. Same if it's 500,000, no matter what that budget amount is, you owe 15% of that award as the applicant. The match can be cash, which is recommended, or it's in kind. The reason that cash match, a direct cash match, is recommended is because it's difficult sometimes for the USDA to discern in-kind purchases and how they actually contribute to match. So it's easy for them to understand and see that you're giving $100,000 to a grant, it's coming in cash, it's clearly been given, and the equipment, has been paid for. In kind makes it a little bit harder to do that, which is why cash is recommended. Match funds must be for a purpose that would otherwise be eligible for the grant. So again, those match dollars have to go to that distance learning or telemedicine equipment. Match funding may not include federal funds unless there's a federal exception. So you might know that during COVID, there were some federal exceptions that said you can use this money as match money for other grants. If it says, if there's, a statute on file that says that, you are good to go. If there is not, then you are prohibited from that use. Only new non-depreciated equipment with an established value can be used as in-kind match. So we talked a little bit about how challenging the in-kind can be to show. Only that new and non-depreciated equipment can be shown as in-kind. A lot of times vendors, because these projects are very large, may give discounts or supply pieces of equipment. And if that's the case, then that is not eligible for match funding. And then there are special matching provisions, I just want to note, for certain geographies. So it's worth, when the application comes out for FY 2023, if you're in one of those geographies, checking to see what your match requirement is. But overall, in general, it's 15%. Teresa, any sort of things that you've seen that may raise red flags or cause challenges for people?
No, I think you've covered it very well. One of the other precautions, if you're considering in-kind match, is to be very careful that what you're proposing is eligible, because if you're proposing your entire 15% in-kind match and you get to us and we discover that what you've proposed as match is not eligible, then you've come to us without a match. So be very careful with your match and make sure that you turn in documentation that the source of the match is agreeing and committing to it. You can't just say the local county commission is going to provide the match. There has to be a letter documenting on their letterhead from someone in authority to commit that agency for the match. It can't be they're going to do it, it's verbal, we've agreed to it, that kind of thing. It's got to be in writing.
And thank you for that reminder. As Teresa said, all match funds have to be written into a letter that's signed by somebody authorized to commit the organization to provide that match. And again, those letters have to go into the USDA behind a match sheet that shows how much you're going to provide in match. They need evidence of the match. So very important to note there. In terms of grant scoring, so looking at both objective scoring criteria and subjective scoring criteria, last year there was 110 points you could receive, and we're going to walk through each of these elements. Again, when we get to special consideration, we will talk about the fact that that changes typically each year. So that's something you're going to want to be looking at. Again, this grant scoring is for 2021, and we'll walk through each component now of the different types of scoring. So your objective scoring starts with rurality, and your rurality is based on your end user sites and your hub sites. So your hub sites are typically in urban areas, and they're not necessarily, they may get some benefit, from the distance learning and telemedicine equipment? If they do, then it's important to note that. But if they, as a hub and an end user, but if they are just a hub, then you're going to note that and your score is going to be calculated for that person. But typically pure hubs are not included in that rurality score, but hub end users are definitely included in the rurality score. So as you're thinking through what your operational needs are, who you would like to partner with, it's also helpful to be thinking about how rural are those organizations and where will I sort of fall on the rurality point score. 40 points is obviously the highest you can get for a end user site, and those are typically your most rural. You'll see here that there's things that say fixed and non-fixed end user sites. Most of the time we're talking about fixed. I'll get into the non-fixed in one moment. But it's important to be thinking through, if your rurality score is 20, it's going to be going against rurality scores that are potentially 40. And so what does that mean? Is there additional partnership that might be helpful? Do you know of an organization that may need distance learning or telemedicine equipment that is more rural, that you don't currently have a relationship with, but maybe it makes sense to start talking with them? So rurality is definitely something that can make you more competitive based on your score, and it's something to be thoughtful about as you start to prepare who you will partner with. Anything else on that rurality score, Teresa or Kristen?
No,
I'm sorry.
I would just mention that if it is genuinely a completely non-fixed end user site, the score is based on the hub. So if the hub is not in a rural area, then you really don't have a project, because we're having to count the hub as your rurality score. That's the only precaution.
That's very helpful. And Kristen, of course, please feel free to jump in if you have anything too.
I think it was very clear, but I think based on history, this is one of the most confusing pieces. I think people get very confused about what's a hub only versus a hub and user. So I'll just kind of reiterate that. Let's take an example of a hospital, and there's a provider who's at that hospital and it's an urban location. If that provider is the only person using that and providing services out to the rural communities, then that's a strict hub. But if that equipment is being used for other purposes and it's being used to serve anyone in the rural area or anyone other than the sites that are involved in the project, then it's a hub and user site. So I just wanted to reiterate that.
That's very helpful. And to both of you, I'm not sure that I've had the chance to actually ask this of you, but typically we see mostly fixed end user sites, meaning it's a specific organization, it's a location that has the equipment that is situated in it. But there are applications through the DLT grants, and we get into a little bit later, but that have non-fixed end user sites. So the most common one that I've seen is different types of ambulances or different types of medical vehicles, sometimes mobile medical vans they're called, and they are outfitted with equipment that allows for telemedicine to go on because they're serving pretty rural areas. Teresa, I know at one point the USDA was looking at the non-fixed end user sites and seeing if they were going to be providing more guidance around those pieces. I don't know where that stands, and I apologize, I haven't asked that in a while, so I'm not sure if you do.
Well, I do believe that we've clarified, our thoughts on it somewhat, but it's still a gray area. One of the biggest things I see with this when you're talking non-fixed end user sites is you get into the very complicated area of monitoring, and patient monitoring is very important. It's vital. It's more important now than it's ever been. But monitoring, even though the monitoring system will allow for you to connect live with a doctor or emergency room or, you know, a provider. It's not predominantly telemedicine live interaction. Monitoring is usually 24/7, and you might use it 1 hour a month if you had a problem. So the monitoring piece is it depends on the circumstances. I have seen it where you could make the case that it was more than 50% use, but that one's a little tricky. But the end user sites are, as you say, more or less where something out in the field gets moved around from one location to another. The medical van is a perfect example. I could see where you might have non-fixed end user sites if you had a group of rural clinics and you were sharing equipment between them. Let's just say Clinic A, you know, had the doctor and the equipment the first week of the month, then you move to another place the second and third. Those could be non-fixed end user sites. I don't see that very often. Ordinarily, you would just ask for equipment for each of the sites and call them fixed. But a lot of that, you know, is strictly based on your business model and what works for you and your patients and or students. So give it some thought. The non-fixed is perfectly fine. Let's just make sure that what you're doing is eligible.
Thank you for that. That's very helpful. The non-fixed and the fixed are definitely some of the challenging parts when you're determining rurality for an organization. The next piece for objective scoring, oops, I'm sorry, I just moved on you by accident, is economic need. And so that's about 30 points. It is the SAPE score. So the Census Bureau Small Area Income and Poverty Estimate percentage for the counties in which the end user sites are in. So the first part of a DLT application is developing a site list where you're literally listing all of your sites in the same order throughout all the worksheets, and you move those sites onto a rurality worksheet where you're literally scoring how rural they are based on 2010 census data. And then you move on to the economic need scoring where you're looking at the Census Bureau's SAPE percentages for counties. So where those end user sites are going to be located are definitely, you know, part of this, and you're looking up what counties, what the county's SAPE percentage is, and you're putting that in and averaging it. So the SAPE score could be anywhere from 0 to 30, depending on economic need in the area. I would say, and others can weigh in differently, you do want to have a pretty good SAPE score, but SAPE scores tend to be a little bit lower than your rurality scores sometimes. So you might have a very rural area, but their SAPE score is still a 10, maybe a 20, but very frequently I've seen 10s. So we don't want that to be a deterrent for folks. We want them to know that, you know, there's any number of things that make you competitive, and it's looking at all of the things together by the USDA, not just one of the objective criterion. Anything that anybody would add on SAPE? Okay. Moving along now to special considerations. So as Teresa mentioned, this is the area where the application may change. There's of course other areas, but again, we're basing this presentation on the last year's grant cycle for 2021. And for this year's grant cycle for 2022, for those FY23 grants, the special point considerations we know are probably going to be different. We know that potentially one of them is going to be cybersecurity and looking at cybersecurity functionality and such. I don't know, Teresa, if you want to mention anything about that, or Kristen. Well, I think Teresa, sorry, Kristen, because she may know more there.
Okay, that's okay. we won't be giving special points for cybersecurity, but cybersecurity is fundable.
Okay.
That had not been in the past. We had not been funding any warranties, licensing, anything that wasn't directly tied to a piece of equipment being funded at that time. But cybersecurity is going to be a fundable item. So if you are buying some cybersecurity software to protect your whole system, and when I say whole system, I don't mean your whole your hospital and 50 affiliates. I mean your whole project. Then we will fund cybersecurity, but that's not going to be a special consideration point.
Thank you for that correction. So not necessarily a special consideration, but cybersecurity will be an allowable expense this year for the DLT program, which is different than has been in years past, which is exciting because I know that some organizations have been trying to address that this year. So back to sort of that special consideration point piece, we don't know what they are yet. We'll look forward to seeing what they are. As what Teresa mentioned, last year was substance use disorders and STEM. And I think to receive the special consideration points, the purpose must be indicated on a special consideration worksheet and in your executive summary and your needs and benefits sections, which we'll talk about. You have to designate that the application is for that purpose. And so that, you know, you're doing distance learning, but STEM is part of that distance learning. That's how we would have handled that last year. Last year it was totaling 10 points, which to an application is a large amount of points and can really make the difference in your competitiveness. So when the new application comes out this year, it would benefit you to see where the special consideration points are and see if those are project areas that you would like to offer either distance learning and telemedicine in, and go from there. And your project does have to fit into the category. Sometimes I know folks try and stretch and sort of say, what if this could be considered STEM? And it is not, and the USDA knows it is not. So it's important just to note that they know those things. Anything else on special consideration, guys?
I do know one change that's coming, and we won't be having opioid or other substance use disorder treatment as special points. Instead, we're doing a 20% of the amount of funding set aside. So they're actually competing in their own category. So that's something a little different. So they won't be in the special considerations, but they will be applying for a specific set of money that nobody else is eligible to apply for.
That's great. So you could have that substance use disorder focus, and 20% of the grants potentially would go to that, or 20% of funding overall?
20% of funding overall.
Okay.
I mean,
Very
your
helpful.
grant, that would have to be the focus of your grant. And then, you know, we're going to be allowed to use 20% of what we have allocated to tackle that category.
So I have a question. Teresa, you mentioned the funding overall. Do you know what the total funding is going to be? Has there been any additional funding sort of brought into the bucket left over from COVID, or do you know?
Well, the only thing that I know is we were allocated 60 million in the budget for FY22. There's always some recoveries for where projects have completed and been able to come in under budget, or where a few unfortunately had to rescind the application for whatever reason. I believe it or not, I actually had one a while back that they put in an application to us for a project and put in an application to someone else for the same project, just in case, you know, whoever's willing to fund them. And they got the funded by both. So they got to pick, you know, which one worked best for them. And in that case, that money goes back into the budget, and it is what we call know your money. So anything that you don't use gets returned, rescinded, and goes back into what's available to use the next time. So we're looking at 60 million plus, I'm not sure, you know, what's been returned over the past year. we do have a group here at the end of the fiscal year trying to clean that up and put as much money back in the bucket as possible. So I would say 60 plus, maybe as much as 61, 62 million. So
Okay.
that's my guess.
Thanks.
Sure.
And Teresa, we're waiting for the announcement to come out to know what the actual budget threshold is for each application. Is that correct? We're not sure what the total budget could be per project per year. I know last year it was $1 million. I didn't know if it, I know that can change each year.
That can change each year, but this year it's not. It's going to be the same. It's going to be, the least amount is 50,000 and the largest is $1 million.
$1 million. Okay, that's very helpful. Thank you for that.
Sure.
So we're moving along to subjective scoring or subjective criteria. I know we've been kind of going back and forth with some questions, but hopefully all of that is helpful to you as you're thinking through putting together a distance learning and telemedicine application. Your subjective criteria and these points are where you can gain some ground, if you will. So your rurality, your SAPE, those special consideration points, those are set. They're the objective criteria. Here, this is you explaining your story to RUS within the USDA and letting them know why you need these services, why you need the equipment to provide these services, what the benefits are going to be from the distance learning or telemedicine services, and how your local community is involved. So on the need for services, you, depending on what type of grant you're offering, and sometimes you're offering both. You're offering telemedicine services because you're a school district who is partnering with the local hospital to ensure kids have behavioral health resources when they need them at school. Sometimes you are the local university who's linked to the hospital, but you're also linking to rural entities so that you can be providing community college or four-year college classes, whatever it might be. But in telling the need, you want to talk a lot about the economics of the area, the geography. How difficult is it to get to class if you're, an organization? I write frequently in Alaska, and I'm told all the time, to go to travel basketball games, our kids take a plane, sometimes a boat, and other means to get to the place that they're going. And then it's going to take us a 2-day travel back. We want them to have a normal experience, but yet they need to be going to school. How do those things work? And talking about the economics of the area or the educational attainment rates, talking about the really hard shifts in terms of disparities that some of the rural populations might be facing in terms of healthcare disparities. We know that right now there's a crisis in healthcare around staffing. A lot of people after COVID are leaving the healthcare industry, and especially in those rural places when they have 1 or 2 physicians that are handling a lot of patients, when they leave, it leaves a huge deficit. And so linking to healthcare services that are in a more urban setting can help fill some of those strains on the community and make sure that people have the services that they need. So really talking about the need for services, especially in the, I say post-COVID, even though I recognize it's still definitely happening. But as we move sort of into transitioning for COVID to be an everyday occurrence, then I think it's helpful to be thinking about those things. The benefits derived, again, this is around how the project's going to help resolve problems. You want to put in how many children, how many kids, students are going to be touched, how many adults might be touched by this project, or how many patients at a hospital, whatever it might be. You want to tell the USDA, here's how we're addressing the problem. This is how we're sort of fixing not having healthcare staffing. We're linking to the hospital that's 200 miles away to make sure we have mental health services for everybody here. And we hope to provide 100 people with those services over the next year and a half or whatever it might be. Your local community involvement, and I'll let Teresa speak to this also, but the USDA really likes to see that you've had participation from your community in planning these projects. And so it's helpful to have documentation around meetings or support, contributions. They don't just want to say, yes, we decided to do this grant. We went out to the local hospital and said, what do you think? And they said yes. They want to know that there's been more community involvement than that, that this is a problem that the community's been trying to address, making sure their kids have access to really good STEM classes, even though they're in a very rural part of California. How do we make sure that happens? And so by having that local community involvement, it shows the breadth of why the community wants the project itself. But Teresa, I can let you talk a little bit more about what might be helpful there.
Okay, and I will say that in the subjective scoring, what I see lacking most is the documentation of local community involvement. We don't need 50 letters from different people saying, yes, we don't have what we need. This would, help solve the problem. But you do need to put forth some effort and show us that you have, and that there are people that are in need of what you're trying to provide, and they'll be happy to get it. They're happy to see that their tax dollars went there, and that you've, exactly as Kathleen has said, you've given it thought. You've got buy-in from everybody that could potentially be benefiting from this. You would be amazed at the applications that I've read, that the plan is out there, and the people that they plan to serve and benefit have not a clue that they're, that the project's even in the background, anybody's wheels are turning thinking about it. And that will not get you very many of your 30 points. I mean, if we don't see that you have a considerable local community involvement, at least document going to some city council meetings or some hospital board meetings. Just use your imagination, and it's perfectly fine for you to get school students to write a letter saying, I'm going into my junior year of high school. I would love to be able to take, a college course this year and next year. That would put 2 college courses under my belt by the time I get out. Or a student write and say, I'd love to have a STEM class my senior year, but there's nothing available. Same thing with foreign languages. Let's just say a student would love to have a foreign language, but it's not available at their school. Well, if you could partner with a school that's got a foreign language curriculum, then they can actually practically be in the classroom at the other school for that particular course. So yes, it's very important to get some local community involvement. One of the things, we do want you to be very specific on the need for services and how you're going to address them. But it also says in the application guide that you need to tell us why this project couldn't be done without our funding. So that's a little something that gets overlooked. You need to, tell us basically that we're your answer to this solution, that, you don't really have a lot of other solutions for this. So those are the main things that come to mind when I see this.
Okay, that's really helpful information, especially on that second piece. I just want to say, why couldn't this project be done through other means or what have you? I think it's great to be talking about the fact that you've applied for other grants and you got certain money, but you still need more funding, or there's just not a market right now for this as we're coming out of having high surges for COVID, which I know some parts of the country that people may be in are continuing those surges. There was a lot of focus on distance learning and telemedicine. As we're coming out of that, there's less money available for these types of things now. And so it's important to be thinking about, is the USDA and is this RUS application something that is going to work for you, and that is something that you can meet all the criteria. So the grant application components themselves, which we're going to run through, but as you can see here, it's a site worksheet. It's an executive summary that is very specific, and the USDA application itself and the guide that comes with it, I will say, are incredibly important. They're well written, they're well done. It's a step-by-step process as to how you apply, especially if it's your first time and you're not bringing in a specific grant writer. It's very good information that walks you through all the different components that you need. And we're going to go through a few of those components, but it's important, and we have been going through the objective and subjective scoring, I should say, but it's important to note that all of these things are necessary for this application. And the USDA has done a great thing, and they have put in a document where literally it is a checklist of all the things that you have to submit with the grant. You literally have to check each box to make sure it's part of your submission and then sign it. An authorized signer has to sign it. And the one thing that I have seen, I know Kristen has seen it and Teresa has seen it herself, I'm sure, is those boxes will all be checked and that form is signed and it is perfect. And then you go to look at a telecommunication systems plan or one of the components that's listed on this slide, and they are not there. And without that piece in there, the USDA cannot review your application because you're missing a component. So on technical review, and Teresa, please correct me if I'm wrong, but it's my understanding you technically are not compliant, which means it doesn't go forward in the review process because you're missing a vital part of the application. So is that correct, Teresa?
Correct.
Yeah.
Yes, ma'am.
So I think it's important that you realize what happens first is technical review. They check the boxes to make sure you have everything that's required. And then you move forward to submission. And it would be terrible for you to have done all the work that you do for these applications and then not have the ability to actually submit the grant itself. So just to walk through again, executive summary, talking about your project. If you're going to have a special point consideration, it's listed. Your scoring criteria, that's that rurality, economic, SAPE score, your site list, all those things. Your matching requirements, the USDA has a worksheet that talks about how much match you'll provide. Literally, it has your budget number, what 15% of that budget number is, and what you're committed to. You have to put letters behind that worksheet stating where you're getting that money from. If it's cash, in kind, whatever it is, those letters have to be there. There's the scope of work that you're going to do that talks about the project, financial information and sustainability that talk about your organization or the consortium as being financially viable. Your statement of experience with other projects similar to this. What have you been able to accomplish previously? Even if you have no distance learning or telemedicine experience, there's the first time you're going to apply for this grant. And so you can say, we've had other grants and we've never had a problem. We've been really successful with implementation. We fill out all of our grant reports. Those are the types of things that the USDA wants to see to make sure you have the experience to carry this out. Your system plan, your telecommunication system plan is showing all the linkages you're going to do for the different sites you have. And then the last piece is your evidence of legal authority, and then some other forms that the USDA has that you need to sign off on. One thing that's incredibly important is consultation with the USDA state director. You have to have a letter from the local USDA office state director stating that you've talked with them about the fact that you want to do this project, that you want to move forward with it, and you'd like their help in thinking through, are there other state monies that exist for the project? Frequently, there is not. And so in that, I would say that, you're giving that USDA office a summary of your project, talking it through with someone there, and then asking them for that letter from the state director. And the local folks at the local offices are wonderful to work with, and they will give that to you very readily, especially if there's no other funding in the area for this type of project, and they note that. Teresa or Kristen, anything else on those grant application components or the consultation with the USDA office for the state?
One thing I would say, the USDA state office is going to want to see a draft or a copy, or at least have a conversation of what you plan to do. But please don't wait until the last week before the application is due and then get in touch with your state director, because they may be off at a conference or, you know, a family crisis or who knows what. Give them 2 or 3 weeks at least prior to your submission to get that letter to you. The earlier the better. That's one really quick, easy thing that you can knock off your to-do list pretty early on. Once you've kind of formalized your concept, even if you don't know exactly how many end user sites you're going to have, you know, how many people are going to agree to participate in your project, if you get a good outline, I would say go ahead and get your state director's letter. We do see that a lot of people forget that. That's kind of like an afterthought, and then it's a scramble. And a lot of times, and this year's probably going to be the case, that you may have some new state directors in that have not done this before. And so the state directors are going to say, exactly what do you need from me? So give us all time to work together. And if you do approach your state director or your general field representative for your area, which that'll get covered a little bit later, definitely ask us to work with you to get that state director letter. We can make sure that they understand what we're asking for.
That's great. And then just as we're coming in, I know we only have about 30 minutes left, so we will definitely be taking questions. But we've put in a couple of slides about developing competitive narrative sections. So the most important thing I can say, and I'm sure Kristen and Teresa would say this also, follow the directions. Those instructions are critical in you actually having a responsive, technically compliant grant application that can be reviewed, especially all the work you put in. So for every single section, there are requirements. They are literally bulleted in the application guideline. You want to follow them to the T. The executive summary, having that strong description, there is a requirement for the description of sites and what types of services will be provided. You want to make sure you're doing that. Again, I said this once, but I'll say it again. You are going to have a site worksheet where you list all of your sites on that worksheet. They always have to appear in that order. If they do not, it is very confusing for the reviewers to honestly review your project when they're looking at different lists on every section. So one of the requirements of the USDA, list all those in the same order. The way that I do that is to do the site worksheet first and copy and paste that list into the executive summary, into all the other worksheets you need, and that way you're checking it. But that's one thing just to check as a best practice. Your scope of work, it's formulaic, and literally again in the guide, that the application guide that the USDA puts out, what activities are you doing, who's carrying them out, what's the time frame you're carrying them out in, and then what is the budget for all your capital expenditures. You literally can do a chart for all of these things that are listed here and put in the activities, who's going to carry them out, what the time frame is, and then taking your budget and literally lining it up with the budget worksheet and stating what all those pieces are for. Charts are helpful. They're easy for the reviewer to look at. And then when there's ease of review, at least when I review grants for other agencies, it makes your score higher because it's easier to read and get through. Your financial and sustainability information, you're providing that robust description of your project's feasibility. The last 2 years have been hard on organizations. I've never had the USDA say to me, if I didn't justify it properly, why did you, the last 4 years you were in the, black and everything was great. Last year you had a deficit. Explain the deficit. COVID happened. We didn't always get our forms of reimbursement as a hospital that we were going to because we shut down elective procedures 3 different times due to surges. they're going to understand if you explain to them what's happening. So those are things to explain. And then when you're getting into your statement of experience, talking a lot about your organization's capabilities, what you've been able to accomplish, and then that telecommunication system plan again, reading those directions, making sure you're following exactly what you have to do. You have to include a map of the overall system. You have to talk about who you've consulted with and, you know, the telecommunication carriers you've spoken to. If you haven't spoken to any telecommunications carriers, how do you know you have the appropriate broadband to ensure that you're doing distance learning and telemedicine? So all those things go into being thoughtful about competitiveness. Any best practices that you would share, Kristen or Teresa, around competitiveness?
Yes. Yes. If you find yourself thinking, I've already put this in a different section, I don't need to put this in again, check yourself, because if it's asked for, as Kathleen said and Teresa, that if it's asked for in that section, you need to put it in there, but to a T, as Kathleen said. So don't get caught up in your head that I've provided this information somewhere else, therefore they don't need it. You will really hurt yourself if you do that.
Great point.
Yes,
and I think the other thing that I would say too is, and it's on the next slide, so there are resources that the USDA has up. They will be, oops, I think I went one too far, I apologize. There are resources that the USDA has available, and they can be found, the websites are on the last slide on this presentation, but they can be found on the USDA Rural Utility Service website for the DLT grants. They're not mandatory that you follow these worksheets, but the USDA has put them together so that you can have them as a resource. I have actually never filed a DLT grant without using their worksheets because they've compiled all the information that's required for technical review in these worksheets. So when I speak about the site worksheet, rurality worksheet, economic worksheet, all the others you see there, there's one package on the DLT website. When the grant comes out, you will be able to download that package. It will be a series of these 6 or 7 worksheets and literally one Excel file where you're putting all the information. It not only makes it easy to do, but it makes the review so much easier for Teresa and her team. And you are expected to have all the information on those worksheets in your grant. So if you don't use that worksheet, you have to use something that's fairly similar in format, or you're not going to meet technical review. So we just find it helpful to use those grant worksheets. Anything else there, Teresa or Kristen? And then I think just lastly, the last and probably one of the most important components of this process, you have to register through 2 different portals. So in order for you to submit a grant, you have to be registered on sam.gov. That actually allows you to register with the system for award management. You have to keep your SAM registration updated annually, and the USDA will ensure that if you receive an award for the 3 years that you have that grant award, you are registered appropriately in SAM. It's how they actually make sure that they're tracking federal awards, and it's a huge requirement. It does take a couple weeks to go through both SAM and grants.gov that I'll talk about in a minute. If you literally saw this grant and think, I'm not going to apply, and it's a week before deadline, and you don't have SAM or grants.gov, submitting is going to be really difficult. So if you are even contemplating you might do it this year, maybe next year, we encourage you to get a sam.gov registration and register your organization with grants.gov. And I think one of the other things to note is under SAM, financial assistance certifications and representations must be made. So there's places within SAM registration where you can do different things. If you do not click that you want to do financial assistance certifications, your SAM is not complete. and the USDA has the right not to have the award go through. Without the certifications, you are ineligible for a grant. So you just want to be checking on sam.gov, am I eligible? And sam.gov has a number of resources you can use. If you think it's complicated, you can call them, they'll walk you through the process. And then finally, registration with grants.gov. Grants.gov is how the USDA receives the actual DLT grant that you're submitting. As far as I know, you're no longer allowed, unless you have special circumstances and in writing to the USDA, you are applying electronically through grants.gov. Teresa, of course, you can correct me if I'm wrong, but in this instance, you have to make sure your organization's registered, and it's sam.gov first, grants.gov second. So just making sure people know that that's a requirement. Teresa, anything there?
Yeah, no, that is accurate. We will not accept paper applications anymore, and especially thanks to COVID and no one being in the buildings in DC anymore. It's a good thing we're moving away from that long before COVID hit. But yes, it all has to be electronically. One thing I would say is the only actual paperwork that you fill out in sam.gov is the SF 424, which is a federal funding request document. Everything else, well, that and the site worksheet, everything else is basically an upload. So you can do all of your work outside of grants.gov while you're waiting to get your grants.gov authorization and while you're waiting to get your SAM registration. And you can go ahead and hit the ground running and do all of this stuff, because when you get to the sam.gov, it's basically going to be an upload for the better part of everything you're going to give us. We will be working away from that into another application process sometime in the next few years. They've been saying that, and of course, it just depends on funding and staffing and a lot of other things. But for this year, it will definitely be through sam.gov, and it will be document uploads. And if you have any problems with grants.gov, they have on their website resources as well, and they're pretty thorough, and you can call them and they can walk you through a problem. If you think you've registered properly and you're not getting anywhere, call them up, talk to them. They can tell you if you've missed one little question or something that's kept you from moving on through. But big thing is get your SAMs early and get your grants.gov early. You don't want that to be a problem in the last 10 days.
And I would just add that if you think that you're active, or you think, oh, that's handled by this person over here, you want to double check. You want to also double check that they have updated and accurate login information. You want to really, we cannot emphasize this enough. If you think, well, we apply for grants all the time, so I know it's active, please just go ahead and confirm that you have an active sam.gov and grants.gov login and authorized representative who's going to be available to help you when it's time to upload.
And I would want to also mention, for those that have done this in the past that have been used to using their DUNS number, as of this past April, we no longer use a DUNS number. We're requiring a number that sam.gov is issuing, and it's called a unique entity identifier. It's UEI. And so even if you have done this in the past, if you were active when they changed in April, they should have issued you a UEI. And if back when I was in a different role, you might do exactly as Kristen said. You think, oh, well, that's taken care of by so-and-so. Well, don't take anything for granted. You would not want, something so simple as that to keep you from being able to submit your application in a timely manner.
Absolutely. And I echo that. the thought of applying early. So we always try and apply at least 72 hours before deadline. It's important to know that grants.gov is being used at all hours of the day, East Coast, West Coast time. There are NIH deadlines where everybody is submitting on certain days for grants. And this is the one portal everybody is using. So those 72 hours can be a lifesaver. There could be an error with the submission. So you submit, you get an error. If you have a couple of days to work that out, you are able to do so and make sure your application gets in. If you are applying at 11:57 and the deadline's 11:59, you are going to have no chance to fix your error. And as soon as 11:59 hits, Teresa and nobody in her office does it, it is a computer generated deadline and it is over, and they don't see any of your work that comes in after 11:59. So important just to note that. And I want to turn now to see if there are questions.
Yeah, so I think,
I'm sorry.
Yeah, absolutely. Thanks, Kathleen and Teresa. I think we've been kind of really messaging this well. The reason we're starting this now is because we know it's coming and we need to start early. Can't emphasize that enough. People get distracted. There's other things going on, you know, business as usual, urgent matters come up. But the entire reason we're trying to get this word out is because starting early is your best bet. You really need to start early. So we do have a few questions. So let me get into a couple of those. I know I had one that I wrote down. So Teresa, I know there's a limitation of 10% for technical assistance. There's a 20% of the grant that can be used for broadband facilities. Is there going to be, with this new cybersecurity addition as an eligible expense, is there going to be any kind of limit of the percent of the grant that can be used for that you know of?
And I just muted myself. Sorry about that. There has not been a percentage set. Everything that is in the grant does get judged by reasonable, allocable, and eligible. So, you know, if you're coming in for a grant for $1 million and you're asking us for 900,000 for cybersecurity, that's not gonna fly.
Right.
Correct. But you know, within reason, I'm sure at some point we will come up with some parameters, but it's still pretty new, so we have not set a limit. But you will need to make the case that this cybersecurity that we're funding is for this specific project, not for your whole entity. It applies to the project. So if you come in with a large number, we're going to be suspicious.
It's going to be questionable. Okay. Right. And I think thinking about it in terms of the core project and the technology that's needed for that live interactive consultation or distance learning occurrence, and then the things that support that. But that core project piece should really read the majority in the budget, and those other things are going to be supportive of that. Okay.
Correct.
Okay, so we had another question about NCES, the National Center for Educational Statistics. That organization does list school districts and their sites, and it does have a label for their locale. And the question is that usable when they refer to rural remote or rural distance as a potential candidate, as opposed to running every specific address through the process?
Okay, let me mention here, there is on our website a DLT map, and the map has layers that shows what's rural and what's adjacent to an urban area. So you can actually go see if it's eligible just basically by taking a quick look at the area on those maps. But now for rurality, if you're going to have multiple end user sites, we have to have a specific address for all of those, or if it's going to be a non-fixed, we have to have the address at the hub site. And so several years back, we used to use the National School Lunch Program, and we did away with that and went to using the SAPE, the Small Area Economic Information. No particular source is perfect, but this is the one that we've settled on for now that best, it is most consistent for what we're trying to achieve.
The map you're referring to. Yeah,
Right.
that is a very interesting map, and as you noted, it can be found on your website. I know that the website URLs are listed here on the last page at the bottom. A little bit hard to see because it's small writing, but if you go to rd.usda.gov, of course you got to do the http://www.rd.usda.gov and look in their programs and services, you can find this. But if you write out all of the rest of this in the URL, you'll go directly to the DLT page. And there are the application guide from the previous year is there. There's the link to the GFRs, the general field reps, and maybe this is a good time for us to reiterate that folks should contact their regional representatives, their GFRs, to be able to get guidance and ask questions and, you know, show what they're trying to accomplish. Do you have anything to add about the GFR?
Oh, absolutely. I have a lot to add about the GFRs. They are your secret weapon. They are our boots on the ground. They're extremely knowledgeable. They are allowed to give you technical assistance up until 15 days prior to the close of the application window. They are not allowed to coach you or write your grant for you, but they are there to answer your questions when you come across the little odd things that you never thought to ask, because it's, you know, not something that you would think of until you got deep into the application. It's very good to strike up a conversation, get familiar with your general field representative, and if you need to, have them on speed dial while you're doing this application. They're very receptive. I was one for 10 years, loved it. To be honest, the Distance Learning Telemedicine grant program was my favorite, even when I was working on all the other programs. And if you have any problems, I do know we have had a lot of new hires, and so there's a lot of training going on. If you run into situations where you have reached out to the general field representative that you have found on our website, and, you know, give them a couple of days. They're spread thin, but if you don't get a fairly quick response, feel free to shoot me an email. You can there's actually the GFR supervisors, which is who I'll be referring, you know, any situations to. We all work together as a team, and, you know, if we have one GFR out for, you know, family medical reason, we've got, you know, at least 2 people covering them. So we're going to get you service. We just ask for your patience, you know, if you run into a hiccup. But hopefully in a couple of years, when we get all these new staff trained, about the time I get ready to leave, things will flow very smoothly. But yes, we just ask for your patience. But do reach out to your general field representatives, because they are a wealth of knowledge, and many of them have come across situations that you would never imagine. So there's a pretty good chance that they've been asked something similar to what you're asking, and they will probably have you an answer on the spot.
That's fantastic. So they're a really good resource to use. I love that you called them the secret sauce. Another question I have, or really more maybe of a comment, is that things like maintenance or installation or project management, all of those types of things, we need to be very, very clear how they're labeled, because some things might fall under technical assistance and some things aren't even an allowable expense. So do you want to speak to that?
Yes, that gets pretty complicated, and I could probably talk an hour on it, so I'm not. I'm just going to say let's be very cautious on that, and that will get covered in depth when we do the USDA webinars. I'm trying to put together some guidance to help guide, excuse me, I'm losing my voice, help guide through that kind of murky zone where you're not sure what something is. And I will tell you, you know, some people call something technical assistance, some people call it technical support. You know, we can fund one thing, but we can't fund another. One thing has a limit, one thing doesn't. So that is a very good discussion to have with your general field representative. And I have to echo what Kathleen said about being very detail oriented. Even many years ago, I told everybody that the Distance Learning Telemedicine application guide was one of the very best I had ever seen to walk you step by step. Even if you've done an application or if you've done several and been awarded, please pay attention to detail in the application guide, because it just breaks my heart to have to come back and answer somebody's question. Well, why didn't I get awarded? And I have to say, especially if it was a borrower that or a grantee that I worked with, come back and say, well, you didn't support your match, or you didn't include a state director letter. Some of those little tiny things. So
you included your checklist, but you actually didn't include everything that was in your checklist.
Right, exactly. Don't go autopilot on your checklist. Do not do that.
I would just add that Solutionz, I've actually been working with this grant since 1994, but I've been on the vendor side. And vendors word things certain ways. They group certain services under certain categories. So as a vendor, we do not write and will not provide any writing and narratives. However, we do provide clarity on these types of things and make sure that in the quotes that you have certain things listed properly. And our job, I always say, is number one is awareness. Our biggest job is to make sure people know that this is out there and they can go get it. The second thing is that we like to be a bit of a project manager and kind of help you through some of these details, because we've spent an hour, almost an hour and a half, and we've just basically given you the words and not really all the detail and context. And this is a heavy lift in trying to submit this type of an application. Generally, we ask that people set up an hour a week once you've determined what your project should or would look like that you're going for, and you've figured out who you want to have involved and what participants and partners might need to be involved. But we also refer back to Kathleen and her firm, because those are the folks that really know how to help you. And it's just really important to pay attention to those details. And we're here to help you if you want to look up, are these sites eligible? Is this a map that we can use? Some of these details that get a little technical, that's where we come in, but we're not at all recommending what you should do or writing your narratives.
I would like to add a couple of other things. When you are doing your budget, please be specific on the budget. Don't say that you're getting a headset, which I prefer you say that than just say I'm getting an MD 221, and then we have to go look up what that is. If you can put all of that in there and you got it at your fingertips while you're working on it, put in, that this is a MD 521 whatever headset. Or be careful about bundling things together, because if you're bundling, and I think Kristen mentioned this, if you're putting things together in a bundle, you may have something in that bundle that's not eligible. And if we run across that, then we might have to throw that whole line out of your budget. And if we do, then you might not have a reasonable or feasible application. Be careful about bundling. Give us some details.
That's a
we
big
don't
one
have
for installation. Sometimes sort of project management and engineering is included in the installation description. Well, those aren't eligible expenses. So if it's installation, it should be described as installation. So.
Right. Exactly. Be very careful with the terminology because it can hurt you.
Mm-hmm.
Any other
So
questions?
I'm looking to see, let me check one more. So there was a question about fixed and non-fixed, and sticking with the examples used, a mobile healthcare center like a specialist ambulance or specialized ambulance that serves strictly rural communities and is constantly visiting different communities every 1 to 3 days, rotating would be considered a fixed end user site. Compare this to traveling doctor or nurse who also moves equipment with them, perhaps in a specialized van. Okay, we talked about that. So how would these two services be different?
Okay, when we think of non-fixed end user sites, that means you really don't know when something's going to be used where. Now, if you have a mobile van and you're traveling around the county and you're going to park in the school parking lot one day and you're going to park in Lowe's parking lot the next over in the next county, those are non-fixed end user sites because basically you can go anywhere, anytime. The way that I would distinguish, we don't consider the equipment that a mobile doctor or a mobile nurse, those would be non-fixed as well. And those would be based on their hub site. Those are not considered fixed end user
Right.
sites.
So I mean, in general terms, another way to put it is if it's not fixed and staying in one place, it's a non-fixed site. And then
Right.
It is based on the score of the hub you mentioned. So being
Correct.
careful that if it is also a hub end user, or if it is a hub end user and not a hub, then that score counts. So if it's not a provider or an educator in a rural area, or if their score is, 20, 30, 40 in rurality, that's going to be brought into your average rurality score.
Right.
So in those questions that I received, both examples were non-fixed. There was a little distinction there. I think they thought it was a fixed, but they're both non-fixed end user. So whether it's a provider in a van, or it's a visiting nurses association, or I had the thought earlier of a distance learning application, especially with what we just went through with COVID. Computers that are provided to the home for students, and for one semester they're here, another semester they're over here, or the next year they're over here. So that would be considered non-fixed, right?
Correct. Yes.
And again, you have to look back to the hub that they're connecting to or linking to and use that score. So if it's a hub end user, you have those scores, and you have to look at the county rurality as well, right?
And I also want to mention that eligibility is based primarily, of course, anything that is required to connect one person on one end to deliver service to a person on another end. But I believe Kathleen mentioned the percentage of use. If it's not predominantly used for distance learning or telemedicine, we can't fund it. It has to be predominantly, meaning over 50%. So we can't just fund
Okay,
computers.
someone's chewing. I think on our team, we just need someone to mute.
Okay. We cannot fund something that is not used 50% for the project. So,
Right.
I mean, computers, if they are the project, are fundable, but let's just say you want to put them in a library and, they may get used 1 hour a week. And then the rest of the time they're open to everybody else to do anything they want to own, apply for jobs or whatever. So be very, very conscientious of predominant use when you're looking at equipment.
Okay. And we only have 2 minutes left. I have one final question. Hopefully it's a quick one. With reimbursement and sending in invoices, are there any pitfalls or anything you would want to say about submitting invoices for reimbursement?
Yes, the invoices have to be made out to the applicant. Now, if you're doing having different people provide the match, those invoices can go to the person that's providing the match. But what we usually do is we see the applicant ordering and submitting the invoice, and then we refund the 85%. So we basically take out your 15%. Then like it gets more clouded if you use in kind. But as long as it's a cash match, it's real cut and clear. You send in the invoices, you tie them directly to a line item on your budget, and the process goes pretty smoothly.
I've always wondered why anyone would refer to in kind, because you can't actually purchase it until after the grant deadline is due. So to me, it's all cash. But so speaking of the deadline, is there any thought or guidance? We're thinking fall, right?
We are. We're looking October, November. And I do know that the process is moving. You know, the wheels are slow, but it is moving. So
we'll have
yes,
60 days. Once it
yes,
hits the street, we'll have 60 days. Anyone who wants to apply has 60 days to pull it together and submit it. Listen, we're right on the hour, the half hour, 2:30. I just want to thank you both so much for helping and joining us and explaining this. And I know there'll be many webinars to come once that you're hosting at the USDA. Thank you very much. We appreciate your time and your input.
Thank you both as well. Thank you. We'll see everyone soon.
Thank you.
Bye-bye.
Bye-bye.
Thanks, everyone.